A very warm welcome to you all. Our guest tonight is Nabulah Fakira. She is a mental health coach for around 5 years. And tonight, during this episode, Nabulah is going to explain to us about what attachment is and how it can affect our mental health. Nabulah, thank you so much for joining us in the studio of the MBC.
Thanks to you. Thanks to everyone. Yeah.
Nabila, mental health is more important now than before. It impacts every corner of our life. The importance of good mental health ripples into everything we say, we think, or we behave. Why, according to you, it's important to spread mental health awareness?
To start with, I won't say that mental health now is more important. I would say mental health was always important, but the fact that people didn't know much about it makes the difference. So today we hear more about mental health. We hear more about people saying, "Oh, I'm depressed," "Oh, I'm having anxiety." So we are getting more into that domain, I would say. But to answer your question, why it's important? Because as you said, it impacts all aspects of our life. It can be work, relationship, the health, our well-being, our mood, everything. So it's very important to talk about it.
But we still see that there is a certain stigmatization around mental health. It's still a taboo for some people. Not everyone have the courage to say that they are going to see a therapist or they are not feeling well mentally.
Mhm.
So why do you think there is that stigmatization around mental health while the brain is in fact just another organ
Mhm.
of our body?
Actually, the way the symptoms is being displayed is what causes the stigma. Because if you're having, for example, a heart problem, you would have symptoms where you would be suffocating, maybe you would have fatigue, etc. But when you have a mental health disorder, the symptoms manifest itself through behavioral changes. You might be having delusion, hallucination. You might be being very overwhelmed. These behaviors are considered as not normal, and when it's considered as not normal, people tend to put that in a corner and stigmatize. So this is why there is a lot of stigmatization. And I would say when people don't understand that they are behaving this way because they are having this issue, uh, this is what causes people to be frightened. So a lack of information, a lack of knowledge about the field is what makes people stigmatize more.
But do you think that the mental stigma has a certain negative consequences?
Absolutely. Why? Because when there is stigmatization in a country, in the world related to mental health, people will tend not to seek treatment. People will tend not to talk about it. And when people don't talk about it, we shut down to this topic, we shut down to this matter. What happened? We don't seek treatment. And when we don't seek treatment, it's not going anywhere. It's going to exaggerate, it's going to get worse. So then the consequences will not only affect you as an individual, but it affects people in your school, people in your family, people at work, at your workplace, everywhere.
So in that sense, it's important to educate people about mental health, right? To break the stigma.
Absolutely, because if we are not aware. I'm not talking about being aware of what's happening around. It's about yourself. If you don't have self-awareness, you can't change it. So you have to know what's wrong so that you can take steps. And usually these steps are not so complicated.
Mhm. Exactly, I was coming to that. Can someone know that he or she is mentally unwell?
Absolutely. I would say in you generally as a person you have to regulate. You have to be aware what's working for you, what's not working. We were talking about overthinking, for example. It's such a common thing that
Yes.
people are saying now, oh, I overthink, oh, I have negative thinking, oh, I have this, I tend to overemphasize on certain matters, and we are normalizing it. I would say that's a first sign that you should there needs to be some calibration there, because as a normal person, as someone very fit and fine, we can't be overthinking about all teeny mini matters. So that would be a first sign, I would say, if you have the tendency to overthink, to have negative thinking, just to make a check there. Is that appropriate? Is that causing harm to me? And if I continue in that pathway, what am I going to get? What will be the consequences? And also, I would say, if for example you are very hyperactive, very anxious in certain situation, that you see your mate, for example, you see your mate, you see your family member, your friends, not being anxious, and you are the one being anxious, I think that we should be asking ourselves the question, am I not having anxiety?
How did you decide actually to be in that field?
Actually, I've started with psychology, and this is where the 5 years, 7 years comes. I was not a coach before, I was just in the field of mental health and counseling. So for me, when all students, when they finish their HSC, now it's the time to decide what they're gonna do.
Yes, true.
And in my context, what happened is I wanted to do something to help people, and I remember having a conversation at home saying, so what am I good at? And I'm good at talking. And this is my strength. I'm very good at talking to people, making people laugh. That was since a child, since I was a child. And I said, if I become a doctor, I will be able to help people. They will come with physical pain and I will help them. Okay, very good. But what about the emotional pain that people go through? I think that's my personal opinion. An emotional pain is much more painful than a physical pain because you don't know where it's happening. You don't know how to change this, how to heal it. And there is little professionals available in Mauritius that would that would offer this service. So I remember my mom saying, like, why not psychology? And this is where it begins. My mom said that word, and we've started the research, and it was the journey. When I've started in that field, I've started learning about the human behavior, all the spectrum of mental disorders that exist. And from that very moment, I decided, so as in the next maybe 5 years, I'm gonna do whatever it takes to start seeing clients, start seeing patients. So this is where I was doing research, and I came to the understanding that meta coaching is something new that will help me connect with clients very easily and offer interventions that are appropriate. So in America, there is a meta coaching world there. So they brought it to Mauritius, and this is where the journey started.
Nice, that's an interesting journey, in fact.
Actually, it's been 7 to 8 years of studying, and I'm grateful to every bit of it because I have the opportunity to touch the life of many people, to bring a change, a transformation in people's life. So
Yes, and to heal them, just to
and
heal them internally.
and to heal them because uh, when you see around with how many people you can talk, and you talk to that people feeling safe and not worrying about the person will judge you, the person will listen to you. You talk to a family member, the next day they're going to say it to their neighborhood. You talk to a friend, the next day they're going to judge you. But with a professional, there's no judgment, there's confidentiality, and there's authenticity.
Yes, Nabila, tonight we are going to focus on attachment
Mm-hmm.
and how it can affect our mental health. As human beings, we are all wired for connections, but for many, it's not that simple. Relationship can bring up complicated feelings for some, such as distrust, anxiety, and even fear.
Mm-hmm.
But first of all, explain to us what attachment is exactly about.
Actually, attachment, I would say, it starts from the very first month or first, as you're born as a baby, you start building connection with your mom, with your dad, or with the person taking care of you. So what happens is the moment you start creating that bond in the person that is caring for you, gives you warmth, love, care for your basic needs, what happens is you create some kind of attachment, some kind of relationship. You start building your knowledge that, oh my God, if I cry, I'm going to get milk. So if I cry, this lady here is going to come and make me quiet, will care for me, will pamper me, will love me. So then you build a certain knowledge, like crying equals to me seeking rescue, me seeking care from my parents, and I'm gonna get it. So you start connecting with the outer world, I would say. So attachment for me is a connection with the outer world, starting with your caregiver first. It's the exchange of warmth, love, and bonding. So when now coming to your question, it's hard for some people. Why? Because since the very young age, what happened is maybe they go through trauma, they go through um, parents not being here, adoption, migration, death of one member, etc. So what happened is that phase is not correctly done. So what happened is now the child's brain is wired in a different way, and which causes a lot of disturbance in the adult life as well.
Okay, so basically, it's the attachment infers to the relationship that we have with our caregivers, and it paved the way for how we respond
Absolutely.
to other relationship during
Absolutely.
adulthood.
Absolutely, because during childhood, what happened is we absorb everything. We absorb every information being put forward. So we not only absorb information about, oh my god, this is a cat and it's cute, this is a dog, it might be dangerous. Not only this information, but we also absorb information like, oh, she's smiling, so she's happy with me. She's doing that face, she's angry with me. So kids captures a lot of this information. She screamed at me, so that means she's not happy with me. So what happened is the kid unconsciously taking these informations, and a lot of time when you have irresponsive parents, so they are not responding to our needs, what happened, the kids absorb the information that my mom, my dad, my caregiver is not here for me, so no one is here for me. I'm not worthy, maybe that's why they are not here for me. And now these kids go to school, kindergarten, pre-primary school. Oh, so my friend Rita's mom is here. My mom is not here for me. So now comparison at an unconscious level makes them feel maybe unworthy. So now they build a mental representation. So as a kid, I'm not getting the love and warmth. Maybe there's a problem with me. So now they grow up with this. So there's a problem with me. I'm not going to talk to my friends. As they grow as an adult, there's a problem with me. I'm not going to find love. There's a problem with me. My husband will leave me. So you see how it's like a pattern that keeps accompanying us till our adult life.
So how can an individual know which type of attachment he or she has?
Actually, I would be very cautious with saying that I have an insecure attachment. Let's say from 6 to 8 months up until 5 years, the kids undergo a crucial development phase. So during that development phase, this will determine whether the child will go through a secure attachment or an insecure attachment. Okay, but let's take it this part first. Let's say a parent is not available for that kid. A parent is not emotionally providing to that kid. So what happened? The kid starts building a mental representation, which is insecure. So that the child don't feel safe to explore the world. The secure base is missing here. So now the kid will develop an insecure attachment, either avoidant insecure. So the child, for example, the child is playing, bump his head, and someone comes and try to calm the child, try to say, oh my god, what have you got, etc. The kids avoid connection. So that's avoidant insecure. The next one is the kid is playing, mommy just disappear, and mommy comes back, the kids becomes very anxious. Okay, we can understand that if a kid is playing, mommy disappear, the kids will be anxious, normal. But when moms come back, why is the kid anxious? That indicates anxious insecure attachment. And there's disorganized also, where the kids is all over the place, not having secure attachment at all.
Mhm.
Now this is early stage in your life, but I'm not going to say that if you have insecure attachment in your childhood, so this is going to happen in your adult life. No. The brain is plastic, and I advocate this. The brain keeps on changing. After every 21 days, we have new neurons taking birth called the neurogenesis. And the brain is plastic, so it keeps on changing. If you had an insecure attachment, if you've had a very bad childhood, doesn't mean that you will have a bad adult life as well. It changes. You have the capacity to learn and relearn and learn. So with the right treatment, with the right support, it's
Yes.
always possible.
Yes. How can attachment disorders, though, relate to insecure attachment?
Okay, so I would give you some examples. Let's say a kid or an adolescent or an adult is experiencing depression. Depression is characterized by persistent sadness, low mood, and lack of interest, insomnia sometimes, poor eating habit, and a lot of symptoms that should be present for 2 weeks or more. Okay, so where does that come from? That's the end result. That's the symptoms that we are talking about. That condition is here because there's a root cause to it. Sometimes the root cause is insecure attachment. When you say that a child is insecure, has insecure attachment, avoidant. So what happened? Avoidant, insecure. So the child is not building connection. The child is not building connection with the family member, with friends, etc. So withdraw from social gathering, withdraw from talking. So they internalize all the pain then. When I say internalize all the pain means something is wrong, oh my God, it's because of me. This is why everyone hates me, because I'm a bad person. This is why mommy don't talk to me, don't care for me, because I'm not worthy of love. So when all of these beliefs gets into our mind, gets into our system, what happens? It starts affecting our self-esteem, it affects our self-confidence, and we don't build bond. So there's a void inside now. With time, this void gets bigger, gets larger, the self-esteem gets even worse. So what happened? We start developing depression. So this is how an insecure attachment leads to a disorder. That's one example. Now another example would be, okay, every time I do something bad, my dad will come with the bell, with a rotabazo, with that stick, and will just hit me without giving explanation. Now, if I do something bad in college, oh my God, they're gonna hit me. So now I become anxious. Every time someone just look at me, I become anxious. So now there's a region in the brain called the amygdala that is responsible for emotions, fear especially. So now every time a person just look at you, the amygdala is hyperactivated, so you start having a release in stress hormones to a level higher. What happens is you develop anxiety. This is why some people, this is how insecure attachment can lead to GAD, general anxiety disorder. There is codependency, which is not a disorder, but which is a faulty way of reacting to relationship. Like a child with insecure attachment, disorganized insecure attachment in childhood, they start developing the idea that I need to control people. I need to be dependent on people to exist. If someone doesn't give me a positive reinforcement, oh, you're looking good, it means that I'm not looking good. So this codependence sometimes causes a fracture in healthy relationship. Like imagine you have a partner, and the moment your partner said something to you, and now you start overthinking about it, you start making a scene out of it. So now it fractures a healthy relationship. And you see this happening a lot in Mauritius. Everyone is saying there's a lot of divorce. Why? No one is asking this question. They would say because of Facebook, they would say because of cheating, they would say but what is leading the person to do that? I'm not justifying that it's good. It's not good. But can't we just do a retrospective and see where's that coming from? Someone not being able to build an attachment, why? No one is asking the question. It might roots to the childhood. So unless we start doing a retrospective, unless we start talking about it, no one's gonna know.
Nabila, but how can someone heal from those internal traumas and attachment disorders?
Well, there is a lot of ways that a person can go through this. The first is, I would say, as this is my personal opinion again, but what is missing is awareness, not only self awareness, but awareness in the general population. You get, I always say that giving birth to a child don't makes you a mom, a dad. You have to learn how to be a mom and a dad. So I would say parental training. Teach people how to become good parents, how to be good parents. Okay? So it can be classes, trainings, how to be good parents, how to actually, techniques, how to cater for the upbringing of your child. That's one. Now let's say that's for, how do you say that? Prevention, not not leading to insecure attachment. The second is, if you know a child is going through trauma, insecure attachment, then go through play therapy. There is certain therapies that are specifically designed to do play therapy with kids and individual session with kids. They have their own way of taking this out, heal the child. So seek these help with professionals. Now, if an adult understand watching this video, this emission today, and say this show, saying, "Oh my God, I understand that I am in that phase." So you and an adult go seek coaching, go seek treatment, go seek a therapist help. That person will help you identify what went wrong and how to correct it. Remember, the brain is plastic, it changes, so make good use of it.
Yes, and Nabila, what's your vision now as a mental health coach?
I have a lot of vision, I would say. I'm still in that phase in my life where you would say in that peak. So in the Mauritian language, we would say kavase, which means that I'm gonna give all my energy, all my not all my time, but most of my time dedicating to my work and to my studies. I work with people, I work with clients, with patients, and the more you see people, the more you realize that you have more to learn. And because of this, after the coaching, after being certified as a meta coach and a mental health coach, I did my clinical neuropsychology studies in King's College London. Why? Because I wanted that medical aspect also. And now after this, I'm looking forward for advanced coaching skills, and I'm preparing for that. Like, how can I get more advanced skills to actually help a client in a shorter lapse of time? So that's my aim. I don't want a client to stay with me for years. I want them within few sessions, they get well, they heal themselves, they get to the next level. So if you tell me what next, so it's gonna be a Nabila that will not stop learning, that will not stop serving.
Ever evolving.
Exactly.
We are actually drawing towards the end of this episode, but before that, Nabila, any advice you would like to give to our youngsters to encourage them to take care of their mental health as much as they take care of their physical health?
Okay, so first and foremost, I would say stop looking at these posts on Facebook and say, oh my God, I think I have this. Because most of the time, these posts are not reliable. So if you are, you don't self-diagnose yourself, but instead be aware that there is certain things that is not normal. For example, if you tend to overthink a lot, if you tend to shut yourself down, if you have a lot of negative thinking, if you are demotivated, if you feel a fatigue, all of these things, pay attention to it and gather all this information and go to a professional. I won't say, I understand that it's there's stigma. Oh my God, I would go and see a psychologist. I would go and see a mental health coach. I feel a little bit uncomfortable. Talk to your general practitioner. Talk to your doctor about it. Ask them, is that normal for me to feel a constant fatigue? This is how I work actually. I would go and talk to my colleagues who are doctors, etc. And I would tell them, okay, so this is what I do. People feel a little bit uncomfortable to come to me first. They would rather come to you and eat some pills. So now I would ask you to make them understand that what is stress, what is depression, what is anxiety, and 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 channel them to the right help. And this is how it works. I practice in Port Louis. So I went to all the doctors in Port Louis and I would say, okay, this is what I do. Most of the doctors, this is what I do. This is my certification. This is my knowledge in the field. So if you see a patient needs help, so refer them to me and I would help. And we work in collaboration. So this is the first approach, a way to take care of your mental health. The next, I would say, is to practice mindfulness meditation. Now it's getting very much popular. The idea of having 5 minutes of mindfulness, download the app of Calm, which is easy, available on your phone. Practice mindfulness. Do exercises, not only for your physical health, but for your mental health. When you do an exercise, you release certain hormones in your brain, certain entities in your brain that will foster the birth of new neurons. Learn new stuff. Even I always do this. I'm very into academic world, but I would always do something else, cooking, etc. Learn something else develops your brain. And when your brain is developing under construction, what happens is you won't get into a depressive phase or harsh mental health disorder. And also build healthy relationship. I can't. I would always say we are wired to build connection. Don't say that, oh my God, I'm gonna download Tinder and I will stay in a virtual relationship. Things that doesn't work. Build healthy relationship, build friendship, have a good partner. I would say seek it. Seek a good family time. Youngsters especially, don't say you won't go to your grandparents' house. Don't say you won't go to a family gathering. Actually, this is where you have to be because you will learn things. You will learn how to take judgments, and this will help you develop and cater for your mental health.
Thank you so much, Nabila. It was a real delight to have you on the set tonight and learn about attachment and how it can have such a huge impact on our lives.
Thanks to you to have asked me such wonderful question and given me the opportunity to actually talk about such an important matter.
Thank you, Nabila.
You're welcome.
Dear viewers, we have now come to the end of this episode. Thank you for your time. We hope to catch you next week at the same time, same channel. Have a great evening.